Namaskar, Swagatam. We would like to welcome you all on Independent Research Ethics Society's journey of knowledge sharing, journey of inspiration, AYUSH Samriddhi. Thank you. We are grateful to you all. Due to your mentorship, cooperation, and guidance, we have been able to achieve 675th milestone in these 3 years. Thank you again. Thank you very much. Today is Haemophilia Day, World Haemophilia, where patient is unable to stop the blood. So, unique subject, very unique subject, and definitely it is need of expertise, need of experts from the relevant line is very necessary. I am thankful for the speakers for accepting our proposal within very short notice. I am sorry that we are celebrating webinar daily and we are circulating our program before a month. Then also we are inviting humbly our speakers within short notice. I would like to communicate my regards to Professor Vishnu Prasad Sharma ji, Professor V.K. Agnihotri ji, Ramakant Yadav ji, our friend Nishant Shukla ji, our speakers of the day, Dr. Atul Desai ji, Dr. Rahul Singh ji, our respected Madam Parul Joshi ji. Thank you. Thank you. Our subject is unique and so is experts are also unique. From homeopathy, from Ayurveda, we tried to invite Unani experts also, but we didn't find that. So thank you very much. I would like to request Professor Vishnu Prasad Sharma ji for his welcome inspiration. Professor Vishnu Prasad Sharma ji.
Thank you. Namaskar. Good evening to everybody. Respected Professor V.K. Agnihotri ji, respected Professor Pavan Kumar Sharma ji, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on hemophilia AYUSH care. Most important subject today we have. So in this webinar, we have eminent speakers. I want to welcome Dr. Ramakant Yadav, Associate Professor, Department of Kaya Chikitsa, All India Institute of Ayurveda, New Delhi. Namaskar, sir, and welcome to this evening webinar.
Thank you, sir.
Next, I want to welcome Dr. Atul Desai, physician and scientist, Sickle Voluntary Clinic, Ayurveda, Healthcare and Research Center, FERA. Namaskar, sir, and welcome you to this evening webinar. Next, I want to welcome Dr. Rahul Singh, homeopathic physician and consultant from New Delhi. Namaskar, sir, and welcome to this evening webinar.
Thank you, sir.
Okay, thank you. Namaskar, sir. Next, I want to welcome Dr. Parul Joshi, ex-principal, Sribala Hanuman Ayurveda Mahavidyalaya, Gandhi Nagar. Namaskar, madam, and welcome you to this evening webinar. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar on hemophilia AYUSH care. Thank you. Namaskar. Over to Pavanji.
Thank you very much, sir, for your blessings and welcome. Now I would like to request Professor V.K. Agnihotri, sir, for his preamble. Before that, I would like to communicate that today is World Herbalist Day also. So previously we were thinking to conduct a webinar on herbalist as a professor. But in the morning, two senior experts of Ayurveda who are manufacturers, Dr. J.P. Singh from Amritsar and Dr. Surya Prakash Sharma ji from Kolkata ignited me to conduct the webinar on adulterated herb, because they are very worried that if herbs will not be available, what our lectures will do without medicine. This was their question, and question is very genuine because they are unable to get pure herbs like hing, like shilajit. These are the common herbs. And we will listen after 9. So 2 days are there. Initially, we are celebrating, not celebrating, we are creating awareness for hemophilia. So welcome, welcome, sir. Now stage is yours.
Thank you, Professor Pawan Sharma ji. Namaskar. And by the ignition of your words, I am here to see that how the hemophilia will be handled by our great learned distinguished guest speakers, because word hemophilia, like any word, is not there in the classics of our Ayurvedic text in Brihattri as well as Lagutri. But we can understand that this is a Raktaj Vikar, or it is an ongoing process where the blood hemopoiesis system might be having some disturbance, or we can say Rakta Dhattvagni. We will have to trace out the deepest form, and when we talk about the Rakta Dhattvagni, it will definitely refer to the Rasagni itself, because Rasat Raktam Tato Mansam. So we have to have the whole of the system in that manner, that how our body is forming the blood itself, and what are the components of blood, and what are the responsible factors which are supposed to make the blood or Rakta Dhatu as such intact. So with the terms of the modern medicine, hemophilia, that is itself the disease of crisis, I should say. In what way the coagulating factors or the factors responsible for the maintenance of the purified blood. Of course, we have to take in the same manner the Upadhatu of Rakta Dhatu also. Even the derivatives of Rasa Dhatu. When we keep our sphere in such a broader manner, probably we will be in position to manage something or some situation which can be near to the hemophilic word, which is we are going to discuss with the help of our distinguished guest speakers. So with these initial words, I am here to invite, I am here to welcome all the guest speakers which are full of knowledge, and we are quite sure that they are going to pour their knowledge and experience to our this platform of IRES today, this evening. Thank you so much and welcome again. And I also welcome Dr. Professor Lakshmikant Dwivedi ji, Professor Nishan Shukla ji, and all those dignitaries, Dr. Professor Dinesh Prasad ji, Dr. Urmalia ji, and those who will join later on to our this platform and also visit our YouTube and archive. Mr. Anand Asti ji is also very much here. He's a good friend of mine. He belongs to, say, Odisha. He's a electrical engineer working there in mining. So he just came and shown his interest to be a part of our webinar. So I welcome him also. Thank you so much. Over to Pawan Sharma. Namaskar.
Thank you. Thank you very much, sir. Thank you very much. I would like to request Dr. Ramakant Yadav, expert of Kai Chikitsa from All India Institute of Ayurveda, just to remind, time limit is 15 minutes for each speaker. So welcome Ramakant ji, welcome.
Thank you, Pawan sir, and I welcome you all on this platform, and especially I am grateful to my seniors and my teacher, Professor V.K. Agnihotri sir, and Professor Lakshmikant Dwivedi sir, Professor Vishnu Prasad Sharma sir, and other fellow speakers, Dr. Rahul Singh ji and Dr. Nishan Shukla, and especially above all, I am grateful to Professor Pawan Sharma sir for having me this evening. Thank you all. And really, first of all, I would like to say that the topic is really wonderful, because now it has become a tradition that there are many days are being celebrated, or it's not celebrated but observed every you can say another day. Every day we have some day. So in the same sequence we have got this World Hemophilia Day. That is a really a major problem of the society, and I think this is more related to the genetic reasons, not any other reasons like infections or any lifestyle disorders or any other causes, but it is more related to the genetic reasons. And there are definitely there is a maximum possibility of bleeding from any part of our system, or you can say body. For observing this day, every I think since 1989 this day is being observed, and now it has many years, more than you can say more than 34 years are there since then it is being observed. And for this year the theme is what is access to all, access for all, prevention of bleeds as the global standard of care. This is the theme for this year's Hemophilia Day. And I think none other than you can say no medicine is enough for such type of disorder, because once we came to know about the hemophilia, then the only solution is left, that is you can say recurrent blood transfusions. So this becomes a part of every you can say individual who is suffering from this hemophilia. And I think there definitely this problem is not very common, and it is found in many thousands of one among the thousands of cases. So but still this problem exists, and we have to take care of that, because nobody is complete. And I think whatever we are working in the field is really important for everybody to take care of such problem. In Ayurveda, I would like to say that there are few conditions which are you can say related to the blood loss, either and most of the conditions which are related to blood loss are condition like Rakpit is there. That is the most important condition. Second one is Rakta Tisar is there, means there diarrhea mixed with blood. And one more condition that is epistaxis, Rakta Pit, you can say Nasagat Rakpit. Such type of conditions are really described in Ayurveda. Also, there is a whole chapter that is describe the you can say lack of hemoglobin or lack of blood content in our body. That is the chapter that is known as Pandu. Pandu is a chapter that is definitely given for the anemic like condition. So there are certain references. As such, the word hemophilia is not used, as Professor Agnihotri sir has also told, that the hemophilia word is not used in our any of the classics, definitely. And but Rakpit like conditions are described, and for such type of conditions there are many measures are also described. If I would like to show some what has been explained in Ayurveda, I just want to show some 1 or 2 slides about that. Let me share my screen. Sir, is it visible, sir?
Yes, yes, you can go for, yes, excellent.
So hemophilia definitely, as I have told, that what is the important, that is a combination of therapy is important. Blood transfusion is also important, and simultaneously many such conditions are there which can be taken or taken care of and can be given to the patient. As far as Ayurveda is concerned, that is really in the chapter of Rakpit, it has been stated that it is like Mahagad. Mahagad means a disease that is very difficult to treat. And what happens ultimately, there is blood loss from the body, and especially that pertains to the you can say more and more use of like bitters and sours and bitters and such type of food substances which are really so we cannot really relate with this hemophilia, but there are certain conditions which can cause a bleeding from our system. Similarly, what kind of blood is coming out from the body, that is also been described. That is blood is that is not really you can say changed in color or something else. A kind of fresh blood like condition is there from the our body, that is means raktasya pittam akhyate. Simply what happens, the pitta content of the blood tends to get increased, and that causes the kind of blood loss from the body. And what I want to convey that as far as the hemophilia is concerned, or any other condition, whatever is described in Ayurveda about the Raktva, there is a Raktva Sroto Mool is described. That is very important. I think whatever the treatment we are doing, we should focus on the mool of that Srotas, like Lihanam cha yakricha tadadhisthaya vartate srotansi raktavahini tanmulan hi dehina. This is the most important message I wanted to convey by through this platform, that Lihanam cha yakricha means liver and spleen. These both organs are the mool of our Raktava Srotas. And while treating the any kind of bleeding disorder, we should take care of these organs also. So whatever the beneficial for the liver and spleen, that would help in treating the conditions like hemophilia. And if we find that there are in Ayurveda, there are a lot of medicines which are described in our text, our classics, that many medicines are described. Most of the are like Tiktharas medicines are described, and really all the Tiktharas medicines are working on our system, especially on liver and our spleen, and ultimately causing a you can say positive effect on our system. So we should take care of this pliha and yakrit, both the organs. If in case of hemophilic patients also, if we can take care of these two organs, then we will definitely be able to give benefit to that patient. Whatever the medicines we can choose, there are a lot of medicines. Ayurveda gives lot of liberty regarding the use of medicines. There are many medicines which are described, either law is described or mandoor is described, or many other substances are also described which are used for the management of Pandurog. But gist of the is that is just to take care of liver and spleen. So that will work a lot for the patients. Definitely, clinical features of the blood are also described, and always there is a chances that whenever the blood is coming out of our body, then that has to be you can say attached with some kind of dosh, like cough or vat or pitta, and every dosh has their own clinical features. And like if it is a cough pradhan rakta, then that will be a slightly slimy in nature, and other like gomutra like and blackish if it is pitta, and similarly like fumes, you can say, or blackish or grayish in color, that will be more by Vatic kind of involvement. So such type of involvement, being a clinician, we have to identify these conditions and treat the medicines and use the medicines accordingly. Definitely, many you can say many prognosis is also described for the bleeding disorders in Ayurveda. If it is really associated with one dosh or one you can say then that is a sadhya type, that is means treatable. If there are two dosh involved, that is difficult to treat. And if the body is lean and thin, or you can say very less immunity and very lean and thin, if he is old and doshas are all the three doshas involved, then the prognosis becomes a bad kind of prognosis. So such type of taken things may also be taken care of. Most important is that if it is really new in you can say nature, what is in Ayurveda, it is always considered the disease which is less than 1 year of time, that is considered as new disease. So if it is new, definitely in case of Rakpit, it is really difficult to make an assessment that whether it is new. But what we can assess that if bleeding is very less, then that is we can consider as ek marg you can say or suksad. If bleeding is massive, then we should take care of accordingly. So there are the conditions which have given the prognosis. Many you can say conditions are described regarding the prognosis, which one we have to treat and which one we should not treat. So many conditions are really described, and most important base, that is principle. After following the principle is always correct. After that, there are many medicines like if you go by the charak, you will find this like chandan, mustak, parpatak, and many things are described like kharjur, mridvika, madhuk, that's a muleti, or falsa, sritashid, means shodra, laja churna. These are the medicines which we are using for the management of Rakpit like conditions. So if such type of medicines, if we can formulate for the hemophilia patients also, or we can supplement in the diet of hemophilia patients, then that will be, I think, of great help for the patient. Similarly, there are many you can say food items which we can use, like moong is there, laja is there, yav is there, krishna, ushir, musta, chandan, bala jal. These are the very common, very simple substances which can be used for the management of such type disorder. Especially these can be substituted as a diet to the patients. Definitely, coming to the little about the history, you can say about the hemophilia. We already know that this is a bleeding disorder, deficiency in the proteins involved in blood clotting and coagulation, associated with a variety of mutations in genes that control coagulation protein production. The more decreased production, the more severe the clinical manifestations. Treatment involves replacement of deficient protein and dependent on severity of problem. So you can say this is the main condition what modern medicine has to offer, and ultimately what happens that causes repeated blood transfusions. There is a little bit history is also there. I would not go into the detail, but since the time of Hippocrates, it was known to have because he wounded soldiers were there and bleeding from there was and skin. If he really established that a small wound stopped, skin covered the blood. Skin अगर उसके ऊपर blood आ जाएगा तो skin से blood बंद हो जाएगा. Bleeding resumed if skin was removed. So such type of historical evidences are also really found. And most important is that Mercurialis observed a clot in vein at body temperature. This is also important. This is way back in 16th century So such type of observations are repeatedly made by our ancestors also. So we should also take the history to our mind also. And with these words, I think I would like to stop my slide share. And I would say that if we can offer dietary changes, if we can offer our that is what I had told, that mool organ, that is yकृत and pliha, we can take care of our yकृत and pliha, we can offer dietary substances. Definitely we will be able to help the hemophilic patients to a great extent. If not able to cure, because everybody knows that it is related more to the genetic problem, but after all the odds, there is a hope that with Ayurveda and Ayurvedic concepts and Ayurvedic substances, we can control such type of problems to a great extent. With these words, I would like to conclude my talk. And once again, I am thankful to our seniors for providing me this platform, and all the officials of Independent Research Ethics Society for having me this evening. Thank you all.
Thank you very much, Dr. Yadav. Nicely explained and briefly explained. Excellent, excellent. Now I would like to request Dr. Atul Desai ji for his valuable comments on hemophilia. Thank you. Welcome, sir. Welcome.
Thank you very much for give me opportunity to join all of my respected senior dignities and professors. Before starting about the subject, I introduce myself. I'm basically PhD in clinical medicine from Maharashtra University of Health Science. And since last 30 years, I'm working on sickle cell anemia, chronic leukemia, HLA-B27, hemophilia, like all these kind of treatment with a group practice. So at our center, we have daycare facility as well as we have 4-bed ICU also with the MD doctor, biotechnologists, pharmacologists, everything. So whatever here I am sharing, it is different from our traditional Ayurveda, and hopefully that you all can appreciate and acknowledge me. So thanks for give me opportunity. And here I started my PPT with a procedure.
Please unmute, sir.
Hello.
Yes.
Is it I'm audible?
Yes, sir.
Okay, I'm here to share my PPT.
Welcome. You are co-host. You can share anything.
Okay, is it slide is visible? Hello.
Now it is coming.
Slide is visible?
Yes,
it is visible.
Okay. Thank you, all dignities, authorities, seniors, and my colleagues. Myself, I am Atul Desai, and here I am going to explore about today's major issue of hemophilia. What is hemophilia and how we treat it, hemophilia as per the Ayurvedic mechanism. So you know that slide show that it's a royal disease. The most of affected people who having quality of life, who having luxurious life, who are the pioneer in their field, who are the kings, who becomes the smart player, they were affected with the hemophilia. And what causes for the hemophilia? So hemophilia is a one kind of genetic disease, and it is a mutation mechanism on the channel of 8, 9, and 10 gene channel. So hemophilia is caused by the mutation or changes in one of the genes that provide instruction for making the clotting factor proteins needed to form a blood clots. These changes or mutation can prevent the clotting protein from working properly or to be missing altogether. These genes are located on the X chromosome. So generally, majority of hemophilia patient belongs to the X mechanism. X in
Your
the
first
sense
slide
way.
is visible, sir.
It is not visible.
It is first slide is visible only. In PowerPoint mode, you can go for slideshow.
Okay, just 1 second. Now is it visible?
Yes, second slide. Yes. In
Okay.
PowerPoint mode, not in slideshow mode.
Okay. In PowerPoint, are you able to visualize the second slide?
Yes, we are able to visualize second slide,
Okay.
but in PowerPoint mode.
Okay, no problem. I share the PowerPoint screen.
Okay.
So males have one X and one Y chromosome, and the females have two X chromosome. Male inherit the X chromosome from their mothers and the Y chromosome for their fathers. Females inherited one X chromosome from each parents. The X chromosome contains many genes that are not present on the Y chromosome. And this means the male only have one copy of the most of the genes on the X chromosome, whereas female have two copies of genes. And thus male can have disease like hemophilia if they inherit an affected X chromosome that has a mutation in either the factor on the 8th channel or on the 9th channel gene. Female can also have hemophilia, but this is much lesser and much rare cases. The symptoms, the hemophilia symptoms is unexplained and excessive bleeding from cuts or injuries, many large or deep bruises, unusual bleeding after the vaccination, pain, swelling or tightness in your joints, blood in your urine or stool, bleeding in your urine or stool, nose bleeding without knowing the cause, in infant, unexplained irritability. Types of hemophilia. Hemophilia A, this is the most common type of hemophilia. It is a classic condition as known as a classic condition of hemophilia. Hemophilia B happens when you don't have enough clotting factor 9, so that known as a hemophilia B. And hemophilia C is also known as a factor 11 deficiency. These all are the depend on the protein mechanism on the gene channel of 8, 9, 10. Usually, right now, the current ratio of hemophilia patient is 1 of 5,000 globally. So it's a big burden of country also. India having too many hemophilia patients. How to hemophilia diagnose? Diagnose include the screening test and clotting factor test, BT, CT, PT, RNA, and INR. It's very important factor. And for specific channel, we go through the mutation gene mechanism screening test for the find out the hemophilia testing. Even right now, government also established neonatal screening test for hemophilia affected neonatal babies. And they provide this kind of facility at government center in India. Treatment medication, clotting factor products, which useful in to clot the bloods, vitamin A, vitamin C like that, you can add it. Plasma derived factors concentration, it is in the format of injection, which you given in the IV section. Recombinant factor concentration, the one of the known medicine is Haemophilia. It's very popular. So who having the severe hemophilic condition, chronic hemophilic condition, they use this medicine. Amicare also useful for this life-saving medicine. And cryptociptan is also useful, but all these procedures require the hospitalized setup And most of in our India, Red Cross Society provide this kind of facility. Now, the major issue is this is the allopathic description. What is the hemophilia? Personally, I felt that few disease who is related to genetic mechanism. Our Ayurveda having also the rich classic genetic description. Even they describe DNA, RNA, and as Ayurveda say that already, Rakta Jivam iti sthiti. In the sense, for Jivan, the blood is very essential and important factor. And our Ayurveda also mentioned the symptoms of purified blood, karma of purified blood, composition of blood, everything in that. But even for genetic mechanism, it's also mentioned that Shukra Shronita Sanyoga Yo Bhavadets Utkrate Prakutina Jayate Tena. So we have rich heritage, but right now we compare the treatment modalities, clinical and treatment point of view. So here I am describing hemophilia. Ayurveda generally focus on individualized treatment strategies based on the dose with the pariksha bhava, then for diagnostic techniques, rather than focusing a disease throughout one drug cure to all approaches. Rakta Pitta, bleeding disorders manifests as an excessive bleeding disorders and can be correlated with bleeding disorders hemophilia. Ayurveda is having a number of dosage form where ahar, vihar, dravyas have been used as a pathya kalpana, Kushmand Avle also useful, and it has been proven in 2015 from one university, I think Nagpur Ayurveda Institute published one research paper on Kushmand Avle, and they put as it's reduced the Pitta Dosa Janya abnormalities, and it is useful in hemophilia, and that is published work in NABL. In Ayurveda, this type of bleeding disorders is well explained in the 4th chapter of Chikitsa Sthan of Charak Samhita under the name Rakta Pitta. As a Rakta Pitta is a bleeding disorders, and in this there is an Asarva Asray Bhava, Asarva Asray Bhava Sampada of Rakta and Pitta. So generally, we recommended few treatments, how to manage them with the quality of life. So we insist them to use good food, good nutrition, good vegetables, consume the all seasonal food, even prevent for any kind of injuries, cuts, and everything. Because my one of friend, he is MD medicine and he having hemophilia, and he is take care of himself with all vitamins, nutritional supplement, and maintain very well. So we recommend him to use herbs and phytochemical medicine for prevention and of heavy bleeding and develop floating time. And every interval of every 4 months go through the BTC, TPT, INR testing. So we given him Yashti Madhu, Usir, Amla, Chandan, and few of immunomodulatory contents, insisting to avoid garlic, chilies, and turmeric in that food, which are very useful for the point of immunity, but it is not useful in hemophilia. So we recommend that, and we observe that we having good quality of clotting time, improving in clotting time. And recently we are on trial process that we have interested in establishing some herbo-mineral formulation. So recently we formulated 2 years back Durva 500 milligrams extract form and along with the 125 milligrams Sphatika Bhasma, and we given them one OD, and they all have also the quality of life and free from clotting issue. If anybody having cuts within 30 to 60 seconds, they stop their bleeding. So there is a possibility we can provide action on the protein channel and we mutate the protein mechanism through the herbomineral formulation. So on the event of Hemophilia World Day, we are very hopeful that we can use Ayurvedic pharmacopoeia and design a new formulation according to standard WHO norms with the establishing pharmacology, toxicology, and evaluate the mechanism in pharmacokinetics way, in biotechnology way, and provide quality of formulation with quality of life to all global hemophilia patients, and that will be our future dream. So hopefully that you can consider this PPT on an academic point of view, and you all have the good time with us. Thank you very much.
Thank you. Thank you very much, sir. Very briefly, concisely, and nicely explained. I am interested to work with you, sir, because sickle cell anemia is the problem of Madhya Pradesh tribal area also. I am in Bhopal at present.
I am the mentor of sickle cell program Bhopal, sir. And to last month, I was with all the government authorities how to design sickle cell program. And there is one Ayurvedic government college in Bhopal. Dr. Umesh Suklaji is the principal.
Yes, Kushilal College.
Kushilal. So I spent my time with that, and very soon we are going to start some evidence-based clinical assessment there.
On behalf of Mansarovar Global University, I would like to offer my services to you if I can come. I was Vice President Imami Jhandu and headed their R&D clinical research for 33 years.
If you require any kind of CRO services, you can give us opportunity because we have the huge time and we passionate to work on the Ayurveda.
Right, sir. Right, sir. Thank you. Our both CRO, I have already CRO in Calcutta, and I am member secretary of CDSCO approved independent ethics committee in Calcutta.
That's I saw on your the back. It's a very privilege. You have independent ethics committee because you know that ethics is a very big issue, and we are not able to obtain the ethical clearance. So we
that
are
I am there, sir. That I am there.
And we are unable to conduct the registered clinical trials. You know that
we can.
You right now, our government also in our support, even AYUSH ministry also in our support. So we claim the disease not with the traditional reference, but with the claim of modern concepts.
Right, I know, sir. Our president, our chairman of ethics committee is ex-director medical education, government of West Bengal. Our clinician is Dr. Kalyan Vrat Bhattacharya, who is renowned neurologist in West Bengal. And basic scientist is head of the department pharmacology, School of Tropical Medicine. And I am only from Ayurveda, who constituted this committee and Independent Research Ethics Society. This committee is under IRES. So we are at your service.
You give us the opportunity to work with you. Because we require only the updating the knowledge. We are not interested to earning the money.
Right, very right. Like me also. Thank you, sir.
I am passionate to do R&D in Ayurveda. We publish more than 35 research papers globally. I am invited scientist by the American National Heart Lung Institute. And we completed 3 clinical trials also.
Okay, sir. Thank you, sir. Thank
you very much. So once again, thank you very much. And if you don't mind, but I take leave because I need to do round at my hospital, sir.
Okay, all the best. Thank you.
Thank you very much. And it's my privilege. Thank you.
We will be meeting in Bhopal, I hope.
Okay, sir. Okay. Anytime.
Whenever come to Bhopal, please call me.
Okay, sir. Okay. Thank you.
Thank you very
much. Thank you.
So now I would like to request Dr. Rahul Singh from homeopathy. Dr. Rahul Singh, welcome. Am I audible to you, Dr. Rahul ji? Dr. Rahul Singh, welcome.
Good evening, everyone.
Good evening, ji. As theory has already been explained, kindly focus on practical points only.
later. I will focus on only homeopathic part. And then right now in my clinic, the patients, and due to very short notice, I have not prepared any PPT, but I will explain the homeopathic part. So, what is hemophilia and the type of hemophilia and cause of hemophilia has already been explained by respected doctors. So, I will focus on the homeopathic approach. So, basically, homeopathy is a type of homeopathy is a holistic system of medicine that aims to treat the person as a whole, rather than just focusing on the symptom of the disease. In homeopathy, the diagnosis is not important for us. We treat a patient as a whole. Means we have to collect all the symptoms of the patient, his or her constitution, and depending on the constitution and the symptoms, we have to give medicine to the patient. And homeopathic medicines are made from natural substances such as plants, animals, and minerals. These remedies work by stimulating the body's natural healing abilities to restore balance and health. In homeopathy, we are not giving any extra salt to the body or any extra medicine to the body. We are just stimulating the body's own natural capacity of healing. In the case of hemophilia, homeopathic remedies can help to reduce the frequency and severity of bleeding episodes. They can also help to alleviate joint pain and swelling associated with the condition, which are the complication of hemophilia. And homeopathy can be used as a complementary therapy along with the conventional treatment such as chlorine factor replacement therapy. So here I want to discuss some homeopathic remedies which can be given on the constitution and the totality of the symptoms. First one is Arnica montana. So, Arnica is a well-known homeopathic remedy to treat injuries and bruises in homeopathy. So, like in hemophilia, there is sudden chances of bleeding and bruises is there. So, we can give Arnica montana. It will help to reduce bleedings and swelling in hemophilia patients. Another medicine is China officinalis. China is also called Cinchona bar. This is a homeopathic remedy, and normally it is useful when there is loss of vital fluid or like semen or blood or any natural discharge. So, in case of hemophilia, it occurs due to the bleeding or blood is a natural discharge of the body. So, in that case, the patient is getting weakness or bruising and severe bleeding, we can give China officinalis or Cinchona officinalis to stop the bleeding and to give extra strength to the body. Then we have another medicine called Haemophilia virginum. Haemophilia is also known as witch hazel, which is a homeopathic remedy. Which is a homeopathic remedy that can help to reduce bleeding and bruising in hemophilia. It is also useful in case of heavy menstrual bleeding. Like if in the case of hemophilia in women, where there is heavy menstrual bleeding, so hemophilia is the has power to stop the bleeding. Basically, the bleeding is comes from venous bleeding. Means the bleeding is from veins. If there is a venous discharge there, then hemophilia is very good medicine. After that, we have lachesis. Lachesis is a homeopathic medicine prepared from the snake venom. So it is prepared from the snake venom, and it is very useful to stop the bleeding and bruising in a hemophilia patient or any other patient. And if bleeding is associated in the women during menopause, so it can be a very useful medicine. That we have phosphorus. Phosphorus is a homeopathic remedy to stop the acute bleeding. If blood is coming from the arteries or blood is bright red, then phosphorus is very good medicine. And if it is associated with hemophilia, associated with respiratory illness such as pneumonia, then phosphorus can be a very effective medicine to treat hemophilia patient. We also having one medicine called aconite metals. So aconite is very useful in bleeding instantly. So in homeopathy, there are so many medicines which can be given on the symptoms, based on the symptoms of patient. There is no specific medicine for hemophilia, but we have to find out the totality of the symptoms, patients like and dislike, element from when it occurs, and other factors of the hemophilia symptoms. We can give homeopathic medicine on the basis of totality of symptoms. And if patient is having other medicines like protein factor replacement therapy, so if that is causing irritation or allergies to the patient due to that replacement therapy, in that case also homeopathy can be given to stop the allergy or to treat the allergy, or it can be given as a conventional treatment for hemophilia by helping to manage the symptoms of the condition and reduce the frequency and severity of bleeding episodes. Homeopathic remedies are made from natural substance, as I said before, and it can help to improve the overall health and well-being of the individual. This can contribute to better treatment outcomes. Homeopathic remedies can be used to reduce bleeding, bruising, and joint pain associated with hemophilia. They work by stimulating the body's natural healing ability to restore. Homeopathy can be used as a complementary therapy along with the protein factor replacement therapy to help manage bleeding episodes more effectively. In addition, homeopathy can also help to reduce the side effect of conventional treatment. If patient is having a conventional treatment and is getting the side effect from that, so it can reduce the side effect also. So homeopathic remedies can improve the body's immune system and reduce the risk of infection caused by repeated injections of that protein factors. So as hemophilia is a rare genetic condition and there is no cure for it. So in that case, we can manage the conditions of the patient along with the conventional medicine or along with the Ayurvedic medicine, and the patient can live a healthy life with the homeopathic medicine. So
Thank you.
this is
Thank
the
you.
homeopathic part, and I'm sorry because there is no time to prepare the slide, so I have to give only small part of the homeopathy. It is a very vast topic, and time is required to manage the whole topic.
Thank you, Doctor.
Thank you, sir, for
We are involving homeopathy in AYUSH for our so many webinars. I hope more than 500 webinars we have conducted with homeopathy. So we are focusing particularly on the disease. We all are now trained in homeopathy due to your expertise. A.K. Gupta ji is there, A.K. Dwivedi ji is there. So really you have guided so much. Salute. Salute to you. Salute to you.
Thank you.
Thank you very much. Thank you very much. Now I would like to request Mr. Parul Joshi ji.
इतना जल्दी खत्म नहीं होता। 13 11 हो गए, बीच में 13 हुए थे।
Anand Dasati ji, please mute your mic. Anand Dasati ji, please mute your mic. I am requesting co-host to mute the mic. So now I am requesting Professor Vaidya Parul Joshi ji for her practical experiences regarding hemophilia. Welcome, madam. She is our guardian of the platform. Welcome.
Good evening, everybody. Namaskar.
Namaskar, madam.
9:05 हो चुकी है साहब, कितनी मिनट दोगे?
10 मिनट।
हाँ,
वो
क्या बोलूं उसमें?
जेपी सिंह जी सो जाते हैं 9:30 बजे। मैं क्या करूं, बुजुर्ग है, 80 इयर्स एज है सर की।
नहीं, मैं ज्यादा टाइम नहीं लूंगी, जरा जल्दी स्किप कर लूंगी। मेरा थोड़ा प्रॉब्लम जो है ये है कि हेल्दी प्रोजेनी के बारे में बात करनी है और जल्दी करनी है।
जी सर,
तो
मालिक आप।
हाँ, इसलिए थोड़ा क्विक करने में प्रॉब्लम होगा। प्रिवेंशन जो है ऑफ ब्लीड्स और ग्लोबल स्टैंडर्ड ऑफ केयर, ये आज का थीम है। और 89 से शुरू किया है उन लोगों ने, लेकिन अब तक अचीव नहीं हुआ है। तो आयुष बिल्कुल जुड़ेगा तो हम इसको जो उनका है थीम उसमें हम कर सकेंगे। अब ये हीमोफीलिया डिजीज जो है वो हमारा तो है ही नहीं, नव्य विज्ञान का है। और ये जो है राजघराना और ये सब बताया गया है, उसमें तो हम नहीं जाएंगे। लेकिन अगर हम ऋतुचर्या में जाएंगे, आयुर्वेदिक तो ऋतुचर्या, तो उसके अंदर शरद काल में रक्त मोक्षण बताया गया है और उससे वात कफ पित्त त्रिदोष सभी का शमन होता है। और रक्त मोक्षण के कई प्रकार है। तो हीमोफीलिया के जो टाइप से ए बी सी, फिर पैरा हीमोफीलिया, ये सब जो है उसमें हम नहीं जा पाएंगे। इट्स ए जेनेटिक डिजीज बोल रहे हैं, लेकिन मैडम पीवी तिवारी जी हर बार बोलते थी कि अगर XX and XY आर द डिटर्मिनेटिव फैक्टर्स, देन हाउ इज इट दैट एवरी फीटस इज बाइसेक्सुअल। तो ये जो थियरी XX and XY की, और माँ जो है हर बार खराब होती है, बिना जननी जन्म तो लेके दिखाओ, लेकिन फिर भी माँ खराब होती है। तो एक्स क्रोमोसोम जो है अकेला इसमें कैरियर नहीं होता है, फादर भी उसमें उतना ही हिस्से वाला है। क्योंकि रस और रक्त में जो आयुर्वेद में बताया है मातृज और पितृज, वो सिद्धांत अगर हम ध्यान में रखें तो माता और पिता दोनों ही 50-50% के हिस्सेदार होते हैं। ये ब्लीडिंग किस तरह होता है, किस तरह नहीं होना चाहिए, ये सब सिखाना मैं चाह रही थी। इट्स ए रेयर डिजीज। जब बोला गया है रेयर डिजीज तो उसको ग्लोबल इसमें क्यों ले जाना। हीमोफीलिया के अलावा भी इतने सारे, जैसे आपने बताया सिकल सेल एनीमिया, वो हमारे अहमदाबाद अंबाजी का जो पूरा आदिवासी रूट है उसमें सिकल सेल एनीमिया इतना मिलता है, राजस्थान में भी इतना है, मध्य प्रदेश तो आपने बता ही दिया। तो ये जो है इसके ऊपर ज्यादा कंसंट्रेशन देने की जरूरत है। जब आप बोलते हैं कि इट्स अ रेयर डिजीज, तो उसके ऊपर क्यों इतना हम ध्यान दे रहे हैं। इसमें सिम्टम्स जो है ज्यादा करके, क्योंकि जो फीमेल हेल्थ है, त्यायते अस्याम गर्भ, उसकी अगर हम बात करें तो ब्रेन से शुरुआत होती है और ब्रेन की कैपिलरीज जो है टूटती है। और वो जो पॉइंट है इसमें ज्यादा ध्यान रखना चाहिए कि अगर हाथ पैर में इस तरह ब्लीडिंग होता है, इडियोपैथिक होता है, कभी भी हो जाता है, तो ऐसे छाले पड़ जाते हैं, तो तुरंत ही जो है ब्रेन को हमें सपोर्ट करना चाहिए। अगर ब्रेन में कुछ प्रॉब्लम हो गया तो काफी सारी दिक्कतें खड़ी हो जाएगी, ये सब दिक्कतें तो साइड में रह जाएगी। बच्चे में जब होता है तब जो बताया आगे एक वक्ता ने बहुत बढ़िया बताया कि बच्चे में जब होता है तो उसमें हमें पता लेट चलता है और उसमें इंजुरीज जो है ज्यादा होगी, क्योंकि हमें पता ही नहीं है कि बच्चा ऑलरेडी इसमें प्रॉब्लम में है। लेकिन एक बात है कि अगर माता या पिता दोनों में से किसी एक को है, बॉर्डरलाइन भी है, तो भी हमें जैसे ही बच्चे का जन्म होता है तो उसका कॉर्ड ब्लड लेके हम लोग यहाँ अहमदाबाद में तो करते ही है कि उसको हीमोफीलिया है कि नहीं है, तो तुरंत ही जान कर लेते हैं। तो माता जब प्रेग्नेंट होती है तो ये सब टेस्ट हो ही जाते हैं और उसकी वजह से ये प्रॉब्लम हमारे यहाँ पे कम है। ये पूरी उसकी हिस्ट्री है, किस तरह हम अब जेनेटिक डिस्पोजिशन पे आ गए, जेनेटिकली उसकी ट्रीटमेंट करके उसमें से बाहर निकलने की कोशिश करते हैं। साहब पूरा इंटरनेट छान मारा, लेकिन चैलेंजेस इन हीमोफीलिया केयर तो 3 ही कंट्रीज में नहीं, चार कंट्रीज में मिला, कनाडा, चाइना, यूएस और ऑस्ट्रेलिया। तो हम देखें कि चाइना जो है पोस्ट कोविड काफी प्रॉब्लम्स उसमें खड़ी हुई है, लेकिन यूएस में जो है 30 to 33,000 पीपल आर लिविंग विथ हीमोफीलिया। और 2021 का सेंसस है कि उनकी पॉपुलेशन जो है 33.19 करोड़ है, हमारी पॉपुलेशन 136 प्लस करोड़ है, यानी इससे तो काफी ज्यादा है, फिर भी हमारे यहाँ पे इतने केसेस नहीं हैं। सो हम चर्चा बिल्कुल करें, क्योंकि हम उनको कुछ देना चाहते हैं, इसलिए हम बिल्कुल चर्चा करेंगे। ब्लड क्लॉटिंग फैक्टर लेवल जो है इसके ऊपर से तय होता है, एक रिसर्च पेपर पे बात करनी थी। यही जो है हम किस तरह उसमें कर सकते हैं। कन्वेंशनल ट्रीटमेंट, एडवांस ट्रीटमेंट तो बताई गई है, और उसमें फ्रीक्वेंसी और एडमिनिस्ट्रेशन ऑन प्रोफाइलैक्सिस कैसे किया जाता है। ट्रीटमेंट ऑप्शंस फॉर विमेन विथ ब्लीडिंग डिसऑर्डर्स, उसमें सबसे पहला आता है हार्मोन थेरेपी, फिर आता है हीमोस्टैटिक ट्रीटमेंट, फिर सर्जरी और आयरन रिप्लेसमेंट थेरेपी। ये 4 मुख्य पॉइंट्स है जब विमेन में ब्लीडिंग डिसऑर्डर्स होते हैं। यहाँ पे हेमोफीलिया की बात उन्होंने नहीं की है, फिर भी हार्मोन थेरेपी जो है उसके ऊपर ज्यादा जोर दिया जाता है। तो आयुर्वेद इसमें सम्मत कितना है वो हम आगे देखते हैं। प्रोफाइलैक्सिस के टाइप्स है प्राइमरी, सेकेंडरी और टर्शियरी। ये जो है हेमोफीलिया पोस्ट कोविड-19 वैक्सीनेशन के बाद डेवलप हुआ है, और ये केसेस हमारे अहमदाबाद में भी काफी मिले हैं। और जब फेस पे होते हैं ना तो महिला बहुत दिक्कत में आ जाती है, क्योंकि हस्बैंड कमेंट करता है ना तो बदसूरत हो गई। तो ये डिफरेंशियल डायग्नोसिस जो है मैंने किया था सिकल सेल एनीमिया और हीमोफीलिया में, तो एनीमिया में सॉरी। तो एनीमिया जो है उसके अंदर डिक्रीज नंबर ऑफ आरबीसीज और हीमोग्लोबिन दोनों में से कोई एक होगा। एनीमिया जो है वो इनहेरिटेड डिसऑर्डर नहीं है, ऐसा मॉडर्न साइंस कहता है, आयुर्वेद नहीं कहता है। हम जानते हैं कि पांडु रोग जो है वो हेरिडिटरी आता है। आयरन डेफिशिएंसी के प्रकार बताए गए हैं, हमारे आयुर्वेद ने भी यही बात कही है। जहाँ पे भी सत्य है वहां पे एकम सत्यम विप्रा बहुधा वदंती। सिकल सेल एनीमिया हम जानते हैं कि ये हेरिडिटरी डिजीज है, और ट्रीटमेंट जो है वो अलग है। तो क्योंकि मेरे स्त्री रोग में आता है रक्त पित्त करई नार्या रक्तम पित्तेन दूषितम, तो इतनी सारी समस्याएं खड़ी हो जाती है कि उसको इनफर्टिलिटी में चली जाती है। इनफर्टिलिटी का एक प्रकार है बार बार गर्भस्रावपात होना। तो रक्तपित्त जो है वो व्याधि ज्वर के बाद आता है, ये हमारे ध्यान में आना चाहिए कि आचार्य ने ज्वर की बात पूरी करने के बाद रक्तपित्त की बात करी है, और ज्वर के दुष्चिकित्सा का एक परिणाम रक्तपित्त है। तो जब हम ट्रीटमेंट की बात करते हैं तो उसके अंदर हम देख सकते हैं कि उन्होंने ये एक बीच में पॉइंट ले लेती हूँ, डायरेक्शन ऑफ ब्लीडिंग और दोष प्रिडोमिनेंस, उसके जो है रक्तपित्त के प्रकार बताए गए। तो ऊर्ध्वक रक्तपित्त, अधोक रक्तपित्त और तिर्यक रक्तपित्त, ये हमारे सुश्रुत उत्तर तंत्र 45 में मिलता है। और चरक के अंदर उन्होंने बताया कफज, पित्तज, वातज, द्वंद्वज और सन्निपातज। तो इसके मुताबिक जो है हम लक्षण देख के उसकी चिकित्सा करते हैं। अब इसमें जो लक्षण है, तो लक्षण जो है वो हमें दूषित रक्त, यानी कि जो दोष है वो दोष से दूषित रक्त के लक्षण हमें मिलते हैं। यहाँ पे थोड़ा जो मेरे आगे के वक्ता बोल चुके थे उनसे थोड़ी आगे जाऊंगी। अन्नम पचती शिखी, जो अन्न जो है वो जठर अग्नि से पचन होके अन्न रस बनता है, उसके ऊपर रस धातु अग्नि कार्य करके मल रूप कफ का निर्माण करता है, और रस धातु अग्नि से जो है रस धातु बनती है, तो उसकी उपधातु जो है आर्तव और स्तन्य है। मैंने यहाँ पे जितने भी हॉर्मोन्स की बातें करी है वे रस धातु में आ जाते हैं, और ज्वर जो है वो रस जो वाहिनियां है उसके द्वारा पूरे शरीर में पहुंच जाता है, मतलब कि वो रस धातु को दूषित करता है, मतलब आर्तव और स्तन्य दोनों को दूषित करता है। और हम जानते हैं कि स्तन्याशय जब एक्टिव नहीं होता है तब भी मेंस्ट्रुएशन में और फीमेल हेल्थ में अपना रोल प्ले करता है। मतलब आचार्य ने जब आर्तव और स्तन्य को रस धातु की उपधातु बताया, उसका मतलब ये नहीं है कि जब वो लैक्टेशन में जाएगी तब स्तन्य जो है वो एक्टिव होगा, क्योंकि हम जानते हैं कि हॉर्मोन्स, जो पिट्यूटरी हॉर्मोन्स जो है उसमें स्तन्य के पर आधारित रहने वाले भी हॉर्मोन्स है। रस धातु पे रक्त धातु अग्नि कार्य करके रक्त धातु का निर्माण करते उसका मल जो है पित्त बनता है। अब ये पित्त जब रक्त धातु को दूषित करता है, तब जाके वो रक्त पित्त का निर्माण करता है और तब जाके उष्ण तीक्ष्ण अम्ल कटु जो है, ये जब रसों का आपने सेवन किया उससे जो पित्त दूषित हुआ, यानी ये पित्त जो है उसका रस है अम्ल रहेगा। वो गुण में उष्ण तो पित्त भी है लेकिन उसमें तीक्ष्णता आती है और तब जाके वो व्याधि स्वरूप लेता है। उसमें लंघन तर्पण दो चिकित्सा बताई गई है। तो लंघन किसमें किया जाता है? बलवान निरोगी होना चाहिए। और तर्पण किसमें किया जाता है? जो कृश है और उसमें अल्प बल वाला है। तो महिला को अल्प बल में लिया जाता है, इसलिए उसमें लंघन हम नहीं करवाते, तर्पण ही करवाते हैं। और आम दोष का पाचन होने के हम लोग लक्षण देख के उसकी चिकित्सा शुरू करते हैं। तो मतलब शुरुआत में हम उसका स्तंभन नहीं करते हैं। इसीलिए जब तर्पण हम देते हैं तो खरजुरादि ब्रूहण और लाजा तर्पण इस तरह के हम देते हैं। और जो हम लोग उसमें ऊर्ध्वग रक्तपित्त है उसको अधोगामी चिकित्सा दी जाती है। अधोग जो है उसकी ऊर्ध्वग चिकित्सा की जाती है। तिर्यक जो है वैसे भी कष्ट साध्य है और किसी अनुभवी का चिकित्सक के पास ही उनकी चिकित्सा करनी चाहिए। उसमें तिर्यक रक्तपित्त में हम एटलीस्ट हम आयुर्वेद के प्रसूति स्त्री रोग विशेषज्ञ इसमें बीच में नहीं आएंगे। मैंने अपने कई पेशेंट्स जो है काय चिकित्सक को रिफर किए। रिफर मतलब हम साथ में मिलके पेशेंट को देखते थे। खास करके जब प्रेग्नेंट लेडी जो होती है उसके अंदर जब हमें ब्लीडिंग पर वेजाइना, सरक्त मूत्र प्रवृत्ति, स्रावी अर्श या नासा मुख गल अक्षी कर्ण से स्राव होता है रक्त का या रक्त वमन होती है, तब हमें उसको काय चिकित्सक की मदद लेके ही जो है कर्म करना चाहिए। क्योंकि आज की पीढ़ी जो है उन्होंने इतने पेशेंट्स नहीं देखे हैं। तो जब प्रैक्टिकल अनुभव नहीं है तो कोई रिस्क नहीं लेना चाहिए। और ज्यादा करके जब माँ प्रेग्नेंट है तो नहीं लेना चाहिए। अब यहाँ पे मैं आ जाती हूँ। वासा फर्स्ट जो है फोटो ये वासा का है और ये तो बताया गया है, सभी को पता है। वासायाम विद्यमानायाम आशायाम जीवितस्य च रक्तपित्ते क्षयिकासी किम अर्थम अवसीदति। यहाँ पे देखिए रक्तपित्त के बाद उन्होंने क्षय लिया है, उसके बाद कास की बात की है। तो रक्तपित्त से क्षय उत्पन्न होता है और वो जो कास होगी वो असाध्यता सूचक होगी। ये कुष्मांड है। कुष्मांड के दो प्रकार है, सफेद भी है पीला भी है। लेकिन इसमें जो है क्योंकि पित्त मिला हुआ है तो हम लोग श्वेत कुष्मांड का ही प्रयोग करेंगे। तो कुष्मांड अवले कुष्मांड खंड पाक जो है मैं अपने पेशेंट्स को देती थी। जब पेशेंट्स जो है अश्रुजा किस्म के पेशेंट्स जब आए थे, लप्त गर्भे अपि सा अश्रुजा, तो जब अश्रुजा के पेशेंट आते थे तो जैसे पहले ही दिन वे आएंगे तो मैं उनको बोलती थी कि भाई पैठा कहीं से भी खरीद के रोज का एक पैठा, यानी वेट आप देख लो एक बार, 30 ग्राम्स का पैठा होना चाहिए और सुबह में लेना है। उसके बाद ही अपना रूटीन शुरू करना है। और बिना फलगृत दिए वो प्रेगनेंसी कंटिन्यू रहती थी और बढ़िया रिजल्ट मिलता था। ये दुर्वा है, गणपति जी को प्रिय दुर्वा है। और दुर्वा का स्वरस शर्करा के साथ मैं अपने जितने भी पेशेंट्स मुझे लगता था कि इसमें मंगल दोष हो सकता है या नाड़ी दोष हो सकता है, तो उनमें मैं दुर्वा का स्वरस शर्करा के साथ दिन में 2 बार लेने को बोलती थी, सुबह 5 बजे और शाम को लेटेस्ट बाय 5 PM। 5 के बाद नहीं देती थी क्योंकि वो ठंडा है। फिर ये जो है वो यष्टि मधु मैंने ले पाई। आया पान जो है, तो आया पान तो हमारे ये एलार्सिन है, उसने तो आया पान करके अपना एक बना ही लिया है। लोद्र सब जानते हैं। ये लज्जालु है। लज्जालु का उपयोग हम लोग बहुत सीमित कर दिए हैं। ये प्योर अशोक है और ये आसोपालव है। हम लोग इसका प्रयोग करते हैं क्योंकि जो प्रायः इसके बाद का जो वेबिनार है उसमें जो डिस्कशन होने वाला है वो यही है कि उपयोग इसका होना चाहिए। आचार्य ने गुण इसके बताए हैं और यूज होता है ये वाला। ये अशोक वृक्ष नहीं, ये आसोपालव है, उसका लैटिन नेम भी अलग है, ये उशीर है। उशीर का हम लोग आसव नहीं देते हैं क्योंकि पित्त इसमें साथ मिला हुआ है, तो निराम हो तो भी हम लोग आसव नहीं देते हैं। आंवला जो है महिलाएं क्या करती है, उसमें नमक डाल के हल्दी डाल के 2-3 दिन रखेगी फिर खाएगी। अब क्षार जो है उसको नहीं देना है क्योंकि अति क्षार सेवन से ही तो रक्त पित्त बना है, फिर धूप में उसको नहीं जाना है लेकिन वो जाएगी। तो ये सब है वो ध्यान में रखने की बातें हैं। और ये वासा स्वरस देने के बजाय वासा का पुटपाक करके वो देने का बात अच्छा है। तो ये क्योंकि उनकी अग्नि जो है वो काफी विषम होती है, तो ध्यान रखना चाहिए। ये चंदन है, चंदन की काष्ठ जो है बहुत नहीं मिलती है, लेकिन चंदन जो है अब काफी बोया जाने लगा है, लेकिन 10-15 साल के बाद वो काष्ठ अवेलेबल होगा। गुलाब जो है अपने चाचा नेहरू जी को प्रिय था, ये गुलाब बहुत बढ़िया औषध है और उसका गुलकंद बना के भी हम दे सकते हैं। और गुलकंद अगर किसी के पास नहीं है तो मैं तो हमारे पीछे ही भद्रकाली का मंदिर था अखंडानंद में, तो मैं बोलती थी कि वहाँ भद्रकाली से ये क्योंकि देसी गुलाब वहाँ मिलते थे तो वहाँ पड़े होंगे, वो ले आ और उसको शर्करा के साथ पीस के रख दे और हर रोज बड़ा चम्मच भर के सुबह दोपहर शाम लेना, रात में नहीं लेना, ऐसा प्रेग्नेंट लेडीज को मैं बोलती थी। ये बला है, प्रायः बला का उपयोग कोई नहीं करता है, लेकिन बला का हम लोगों ने उपयोग किया है। अकेली बला, उसका स्वरस निकालो, उसका पूरा यानी पंचांग लेके उसका स्वरस निकाल के महिलाओं को मैं देती थी और बढ़िया रिजल्ट मिलता था, असुरदर में भी और असृजा में भी। ये स्फटिका है, शुद्ध स्फटिका, शुद्ध गैरिक और लोद्र का कॉम्बिनेशन दिया। अगर लोद्र नहीं मिलता है तो शुद्ध स्फटिका शुद्ध गैरिक सम प्रमाण में देना चाहिए। शुद्ध स्फटिका अकेली कभी न दे क्योंकि पेशेंट को बहुत प्रॉब्लम्स हो जाती है। ये लोद्र है, लोद्र चूर्ण है। और ये जो है प्रवाल की माला है। तो जिन महिलाओं में मंगल बहुत प्रबल था या फिर उनके पति को संतान सुख न हो, तो मैं ऐसे प्रवाल, इतनी बड़ी माला तो बहुत महंगी हो जाती, 1-2 उसकी बीड्स जो है उसको गले में पहनने को बोलती थी। ये प्रवाल है, ये प्रवाल पिष्टी है, प्रवाल पंचामृत है, उसके साथ शुक्ति भस्म भी है। तो ये साउथ में जो पुस्तक बहुत ही चर्चित है उसमें से हम ले तो बोलबद्ध रस, लोत्रासव, द्राक्षासव ये लोग देते हैं, लेकिन मैं द्राक्षा अकेली ही लेने को बोलूंगी। कामदूधा रस जितना रिजल्ट देता है उससे बढ़िया मुझे स्फटिका गैरिक से रिजल्ट मिला। और एक बात यहाँ पे बतानी चाहूंगी कि वे बोट्रोपोज करके एक इंजेक्टेबल आता था, जब ज्यादा मात्रा में ब्लीडिंग होता है तो स्नेक वेनम से बना हुआ बोट्रोपोज इंजेक्शंस देते थे। ज्यादा से ज्यादा आप 3 दे सकते, उससे ज्यादा नहीं दे सकते। लेकिन मेरा ये हम्बल ड्रग स्फटिका और गैरिक उसका मिश्रण करके मैं उसी पेशेंट को जिससे बोट्रोपोज से रिजल्ट नहीं मिलता था, उनमें मैं स्फटिका गैरिक 1-1 ग्राम मात्रा यानी 2 ग्राम हुआ तो मैं थोड़ा गैरिक ज्यादा डाल देती थी क्योंकि स्फटिका 1 ग्राम बहुत ज्यादा हो जाएगा, इसलिए गैरिक में ज्यादा डाल देती थी और उसको देती थी सिर्फ पानी के साथ लेने के लिए और मुझे रिजल्ट मिलता था। तो रक्त जो है, रक्तम जीव इति स्थिति, जब सुश्रुत ने बताया है कि जीव जो है रक्त के अधीन है, तो रक्त का महत्व समझ के जिस किसी को हेल्दी प्रोजेनी चाहिए, जो हीमोफीलिया से पीड़ित न हो, सिकल सेल एनीमिया या किसी भी प्रकार के एनीमिया से पीड़ित न हो, ऐसे जब हमें प्रोजेनी चाहिए तो रक्त की शुद्धता पे ध्यान दे। और आयुर्वेद में रक्त को शुद्ध रखने के कई उपाय बताए गए हैं, दिनचर्या में भी बताए गए हैं, ऋतुचर्या में बताए गए हैं, और हमारे दिनचर्या ऋतुचर्या के मुताबिक ही हमारे आहार और विहार आचार्य ने बताए हैं। थैंक यू एवरीबॉडी, थैंक यू पावन सर एंड अग्निहोत्री सर, थैंक यू IRES for giving me chance to speak on such a nice subject.
जय हो, जय हो, जय हो मैडम, जय हो। ये लेक्चर तो 1 घंटा भी चलता तो मेरे ख्याल से बहुत साइंटिफिक होता। मैं क्षमा चाहता हूँ, आप जैसे विद्वान को रोकने का साहस नहीं है मुझ में, प्रार्थना ही कर सकता था, लेकिन आपने बड़ा गजब किया, आपने इतना परफेक्शन एक प्रेजेंटेशन में दिया है, मैं नमन करता हूं आपको। आप ऐसी कृपा बरसाती रहे, ये मेरी प्रार्थना है आपसे। थैंक यू वेरी मच। मैं आदरणीय प्रोफेसर वीके अग्निहोत्री से संक्षिप्त उपसंहार की आशा करता हूं। आदरणीय सिंह जी नेक्स्ट वेबिनार की प्रतीक्षा कर रहे हैं, मैं तब तक लिंक चेंज करता हूं। स्वागतम।
नमस्कार, थैंक यू प्रोफेसर पवन शर्मा जी, आपने बिल्कुल सही कहा। और अगले वेबिनार की पूरी तैयारी हो गई, समय भी हो गया है। मैडम ने 9:05 पे शुरुआत की थी और 9:18-20 तक खींच लिया। मैं समझ पा रहा हूँ मैडम जोशी जी को अपने लेक्चर को शॉर्ट करने में कितना मानसिक कष्ट हुआ होगा, क्योंकि हम सुनने वाले तो वंचित रह ही गए। बहुत बड़ा विस्तार से चर्चा की तैयारी उन्होंने रखी थी, लेकिन हमारी स्थिति तो यह है कि हमको यदि यूनानी से मिल जाते तो एक हम उनको उन मनीषी को भी लेने चाहते थे। तो जब ज्ञानी बैठते हैं तो समय का अभाव होने लगता है। बहुत खुशी की बात है, आज हमारे अतिथि वक्ताओं ने बहुत ही ईमानदारी से